Thank you. I rise to take note of answers given by the Honourable Rose Jackson, Minister for Mental Health, and in particular her answer about the concrete steps that are being taken to reduce the frankly unconscionable waiting times for those suffering mental illness who are presenting at the emergency department at Westmead. Waiting times which are being documented as long as 93 hours. And that's hard enough to wait when you have a broken arm, but when you may be experiencing psychotic episodes or suicidal ideation, that is a tremendously long time to be waiting for some treatment and some relief. And the Minister, when asked about concrete steps, talked about who she was talking to and what they were talking about. And I particularly took note of the fact that of all the people who are involved in these discussions of what we're talking about doing, talking about actually addressing this real-life, everyday problem for people presenting with mental health issues to our emergency departments, the one group I didn't hear involved in that conversation are psychiatrists. There was discussion with nurses, there was discussion with health districts, there was discussion with bureaucrats, but there was no discussion with psychiatrists. Surely psychiatrists are an important part of our mental health service delivery, and surely they shouldn't just be relegated out of the picture or apparently redesigned out of our mental health picture in the way that this minister appears to want to do. And I take note also of the ongoing, seemingly never to be addressed staff dispute with staff psychiatrists. The Minister raised the issue of safe havens and pointed to them as a possible different model. I've had the opportunity to visit safe havens in connection with a committee of inquiry of this House. They are tremendous places when they're open, which is at very restricted hours, certainly not the 24/7 that our emergency departments are open. They are tremendous options when they are in geographically accessible places, when they are served by bus routes or train routes that people in distress can access. And they are tremendous places if you know that what you want to do is to commit suicide. But of course, that isn't always how the issue presents. One doesn't always have that self-awareness, and we need to be providing a wraparound, whole-of-person mental health support, which this government is certainly not providing.